One of the first things that we're going to talk about bed baths is how to do the bed bath mitt. So you can take one of your smaller towels and wrap it around your hand like this, so it's folded around your hand, and then bring it forward and tuck it like so. So it's like a little mitt. I'll do that one more time. So take a towel, wrap it around your hand, so it's just folded around your hand like this, and then fold it forward. What's nice about this is once you actually start performing your bed bath, you have multiple areas to bathe your patient that are clean. So that you can use this side, and then flip it over and open it up and fold it that way, and use this side and this side. Often, we'll get into this in a minute, but for personal protective equipment, I always personally wear gloves while doing a bed bath, just because you never know what you're going to run into. Obviously, you'll follow standard precautions. So if you're worried about soiling your scrubs or anything, you can always wear a gown. You can kind of read the situation. Okay, so we talked about the mitts, and now we're going to talk about the different ways you can perform a bed bath. So, ideally in long-term care, if your patient is mobile, getting them up and into a shower is the preferred method. So if they can do that, that is what we want you to do. But of course, you would need to be mindful, like, of in the shower, it gets warm, they can get lightheaded. So take into account all the safety factors of your patient and make sure that they can tolerate a shower. And if they can, that's the preferred method. And then also they can have, like, there's different types of baths. What we'll do is a complete bed bath. They can also have therapeutic baths, which is for like skincare. And so it's not necessarily just for the cleaning aspect of bathing. And stuff like that. So, but if your patient is like unconscious or isn't able to be moved, we're going to be doing the complete bed bath. Some facilities have these nice bed bath packages that have you that are like, you just have to get water on them, and they're already infused with cleaning solution, and a lot of times they are no rinse, so you just have to wipe down and then you're good to go. So yeah, that's what these look like, and they come with multiple wipes where you can use one wipe to wipe one leg, another wipe to wipe another, one for the torso, one for the arms, one for the face, and they're one-time use, so then you just trash them. Okay, so that's the easy way. If you're not fortunate enough to have these cleansing cloths, you will do a complete bed bath using your bed bath supplies. So this pink bucket, or any bucket that they use for baths, you can find in your facilities. And I usually like to have two. So I have one here that has my soap and warm water. And like here, this is body wash, shampoo, and perineal cleanser. So you can use that all in one. So I put that with my warm water, and then I have one that's just for rinsing that is regular warm water, and bring those into the patient's room. So of course you'd introduce yourself, make sure it's a good time for them. Ideally, you would have already checked with them earlier and planned it out, so that they already knew this was coming. And let them know, like, if you ever feel uncomfortable, you can for sure stop me. Of course, you've washed your hands when you come into the room. So one of the things you want to do is let the bed bath blanket work for you. So if I was working with this patient, hold on one second, let me grab one more bath blanket. So if this patient is in bed, I'm going to use a bath blanket and then their regular sheet. So my patient's still in a gown. and I can just expose the area that I'm going to be cleaning. One of the things, and this is a Jacqueline thing, not necessarily ATI, if you give him a bath, change the gown. It's kind of pointless to give him a bath and then put on a dirty gown. So have that be a part of what you're doing. So you have your 2 buckets, and then I would place cloths in the washing basin and cloths in the rinsing basin. So when I'm first going to wash her face, so I'm going to make my mitt, and I'm going to clean from the inner canthus to the outer canthus of her eyes. And note that this one I'm just using water. I didn't put it in my cleaning solution because with the eyes I'm just going to be using water. Great, that's all done. And then I can use another side, and maybe I want to get some cleanser here or just put it straight in the basin, and that's up to you. And I'm going to clean her face. Great. And then if she can't sit forward, I'll have her sit forward and clean the back of her neck. And then I'm done with this cloth. And then I can rinse from my rinse basin. Rinse her face. And then you have a separate pile that's your dry. So you will want to have plenty of towels because you're going to be washing, rinsing, and drying. So you'll need a pretty big stack. All right, so we did the face. Now let's go to her arms. Like I said, you can do your mitt, and I got it in my washing basin. And what the principle I like to apply is I'm going to go from least dirty to most dirty. So when I think of the arm, I think of the armpit being the most dirty. So I'm going to start at her hands and work my way up, being sure I cleanse every surface, and then the armpit. And then I could go over to the other side with my wash and with my cleaning towel and do the same thing, rinsing, washing all the surfaces, ending in the armpit. Then I'm done with this one. And then the same thing with the rinse and then the dry. And what's nice about that is it also helps promote circulation or venous return because we're going in the way, helping our veins carry that blood back by massaging when we do our cleaning in that motion, which is the motion that the veins are going in. Okay, perfect. Then for me, I like to do, I'm trying to think what I prefer to do. I'm going to do the legs next. So like we said before, we're going to make our bath blankets work for us to make sure that the patient is as least exposed as possible and expose the leg. All right, and the same principle. Dirtiest to cleanest. And that might, you might think okay, their feet are super dirty. We're going to just do the feet as their own separate thing. That's totally fine. Use your nursing judgment. So I use my washing cloth. I'm going to clean her feet, legs, all surfaces, mid-thigh. And like I said, maybe the feet are super dirty and you can do those separately. On both legs. And now I'm going to dry. Rinse, because it's soap. Rinse. Both legs. And then dry. Both legs. It's really important, especially for the older adult population that we'll be working with in clinical, to make sure you dry all the surfaces because otherwise it can cause skin breakdown and any skin crevice. So be sure you're doing a thorough job when you dry. Okay, so we're done with the lower limbs. We'll talk more about foot care in a minute. All right, and now this is where I kind of like to use 2 bath blankets. I'm going to cover her chest and just expose her stomach and clean that. Same process. Wash, rinse, dry. And with older adults, you'll notice sometimes they have the larger abdomen that hangs over. That's called a pannus. It's really important to lift the pannus and cleanse underneath that and rinse and dry, because that if you don't dry that part, that can cause significant breakdown. Okay, perfect. And now we can expose the chest. Same principle. Wash. And if they want to wash, if they have the ability to wash themselves at all and want to, I would offer that to them at any point. Wash, rinse, and dry. At this point, I would have my patient transfer, if they can, or I'd get another helper, to turn the patient on their side in order to do their back and their bum. So do their back, same principle, wash, rinse, dry, wash and dry. Especially with the back of the legs, because you probably didn't, unless you were super strong, didn't get a good washing of the back of their legs. So have her turn to her side if she can. There's some patients that for whatever reason, maybe based on doctor's orders, you can't turn them to their side, or maybe you can only log roll. So get the appropriate amount of people that you need in order to do that safely and per the provider's orders. So turn to the side, like I said, same principle, wash, rinse, dry. All right, and now we'll cleanse their perineum. So obviously you want to make sure you forewarn them, make sure they're okay with it, but it is important to clean that area. Provide privacy as much as possible. So for women, you don't want to use, let me make sure this is per ATI. The best positioning is knees bent, legs slightly apart. So ask your patient to assume that position with both legs. Sorry, just want to check one thing. Perfect. So, you can use the soap, especially when we're cleaning the inner thighs, and it's especially important here to make sure that each you're using a different part of the washcloth with each stroke. So, using my washing washcloth in the inside of the legs, and note how I'm trying to keep her as minimally exposed as possible. Perfect. And now get a new washing one and cleanse. Make sure you cleanse from the urethral meatus down to the anus and not reverse, because that could cause potential infection. So I use this side, so I'm going to use this side. I'm going to flip it over and use another side. This side. And then rinse. And then dry. Perfect. And at this point, you could help the patient, like it shows an ATI, change their gown. So you can give them a new gown here, and then help them and use the bath blanket to keep them minimally exposed. So for male perineum perineal care, what you want to do, so this is for male who have been circumcised, males who have been circumcised. So you're going to clean the inner thighs like what we did before, and then clean the tip of the penis in a circular motion, and then down the shaft, and then the upper skin and scrotal areas. And same principle, wash, rinse, dry. If they have not been circumcised, what you want to be sure to do is retract the foreskin, clean that area, return the foreskin, and clean in the same process as before. And just be sure you also wash, rinse, dry in that same order. But the only part you have to add is retracting the foreskin and cleaning that area as well. Okay, so that is it as far as the bed bath goes. We're going to just talk about some other things. We're going to skip bed making for a minute, and we're going to talk about nail and foot care. So a lot of times when you're giving a bath, you could, if your facility allows you to do this, and we'll talk about that in a minute, but you could wrap your patient's feet in a warm towel to get them nice and not dry, and then you can clip their toenails or file depending on facility policy, and clean their toes. It's really important that if you do that, that you make sure you dry in between the toes as well, because that's another great spot for moisture to stay and for skin breakdown to occur. Those who have peripheral vascular disease or diabetes, it often requires a podiatrist to perform that function of any sort of foot care. So be sure you're aware of your facility's policy if your patient does have diabetes. Often, you as a nurse are not allowed to do the foot care. Why is that? Because feet and peripheral neuropathy occur with diabetes, and often, like if you cut the nail and there was like a slight bleed, it could get infected and cause that patient to lose that limb. So that's why we reserve that for a podiatrist. But if you can, great. Like I said, just make sure clean, rinse, and really make sure you dry their feet. Check with your nurse and facility policy. There are some facilities where nurses can't cut toenails, but they can file. So if you do that, or if you can cut, be sure you're cutting straight across and filing straight across to help minimize any sort of injury to foot. Okay, perfect. And now we're going to talk about shaving. So, for those of you who shave your face, you probably know this, but in case you've never done that, we'll talk about it. So there's two types of razors. You have your straight edge or an electric razor. You want to be sure you use an electric razor for those who are on anticoagulation therapy, low platelet counts, heparin therapy, aspirin therapy, because your likelihood for having a cut with the straight edge is more likely than electric razor. So make sure that, as according to facility policy, you can place the shaving cream after you've given them a bath, or maybe they're just wanting a shave today. Make sure that the face is warm. Place a warm towel around the patient's face, and then you can apply the shaving cream and then shave with the growth of the hair. So usually, like on the cheeks, the hair is growing down this way, so you want to shave with that grain. And yeah, so anyone else can use a straight edge according to facility policy, but if the electric razor for those on anticoagulation therapy. All right, I think that is it. Oh, and after you've bathed your patient, it's always a good idea to use deodorant. You can use skin protectant or lotion if the patient wants it. So you can always offer those following a bed bath. All right, so now we're going to move over to bed making.